interested in whether deprivation affects access to healthcare services. I think health inequalities are a good indicator of social inequalities, and these are a product of unequal distribution of power, money and resources, coupled with inadequate government policies. So as long as these social inequalities exist, we're also going to have health inequalities. It may not be possible to completely eradicate them, but we can at least reduce the gap by changing our social policies.
With regards to vision, there's quite a few barriers to access. There's geographical problems, so the location of primary eye care. Cost can be a problem as well. There's the general perception of primary eye care to patients, what they think of opticians, what they think of the practices and the financial aspect of practices like that. One of the problems with primary eye care is we don't have good quality data. So we don't know how many people in the country are having eye tests, we don't know the prevalence of different pathologies, so we'd like to improve the data that's being routinely collected a little bit. Also, we're looking at accessibility in other countries to primary eye care, so we're currently applying for grants to look at primary eye care provision in countries in Africa.
Some of the drivers behind the inequalities are the standard ones that we see in other health outcomes as well, like socio-economic status or barriers to services, that kind of thing. But there's some that are also more specific to hearing itself, so noise exposure for one, and also some of the cultural attitudes towards ageing and hearing health specifically. I need to try and start picking apart why hearing aid uptake seems to be lower among minority ethnic groups. And to do that, I'm going to do some qualitative research, conducting interviews and focus groups to try and unpick some of that.
We know that a huge proportion of hearing and vision impairment is preventable. Up to 80% of cases of hearing and vision are due to preventable causes. And these are all related to lifestyle and environmental kinds of factors, like unhealthy diet, smoking, noise exposure in the case of hearing impairment, cardiovascular disease and diabetes. And all of these sorts of lifestyle factors are associated with deprivation. So we think that there's not one straightforward answer, but it's probably a multifactorial combination of things that impact on hearing and vision health. So that also gives us an opportunity, because if 80% of these cases can be prevented, there's a huge opportunity to reduce the burden of hearing and vision impairment in the population and improve quality of life for thousands and hundreds of thousands of people. We're using big national data sets to understand the causes and consequences of hearing health inequalities and the benefits of early identification and treatment of hearing impairment to improve outcomes for older people with hearing difficulties.